Animals. Leslie Knopp joins us now live from Harborview Medical Center, where doctors are trying to save the baby.
Reporting live at Harborview.
Live from Harborview Medical Center.
Often we think disaster only happens to other people, but in reality, disaster can happen at any time, without notice. It can happen to anyone, anywhere. Tonight we highlight the success of the Burn Center at Harborview, a facility that is at its best not only in dealing with today's disasters, but is at the forefront of research to better handle the disasters of tomorrow. When Jason Imhoff started fighting the 30-mile fire, he couldn't have foreseen the imminent danger he and his team would face. Jason was the only survivor in his group, and doctors had to use innovative techniques to aid in his recovery.
Doctors are excited with the way Jason Imhoff's badly burned left hand has responded to a procedure called a crane flap.
You might not be a violinist or a concert piano player after this, but I think short of that, he ought to be able to do just about everything.
Surgeons recently made an incision in Jason's abdomen. They put his hand under that skin, like slipping a hand in a pocket. It would stay there 3 weeks. The hope was fatty tissue inside the abdomen would attach to the tendons in his hand. It was their best chance to save the hand. Today, they discovered it had worked.
You know, him knowing that he's sort of out of the woods right now, it's a relief to him to know that he's going to be able to move 2 hands around.
Steve Imhoff says it's been a long 4 weeks since he first got word his son had been caught in a firestorm that killed 4 firefighters. Jason still has nightmares about the incident, according to his father, but physically he's getting much better, especially his other hand, the right. He's now feeding himself, shaving on his own, and writing letters.
The letter that he wrote to his brother, he used that pen right there and was able to grasp it and write a very legible letter. So he is doing very good with the mobility in his hands, or hand.
You'll have to excuse a father's slip of the tongue. The good news about Jason's recovery has Dad already looking ahead to the day when his son will once again be using both of his hands.
A truly touching story of innovation and survival, considering that in 1945, severely burned victims only had a 25% average chance of survival. Today, even patients with the most devastating burns, covering more than 70% of their skin surface, have a 50% chance of survival. At Harborview's burn unit, the overall survival rate now stands at 96%. Harborview's Burn Center has also been at the forefront of working with industry leaders to create products such as Integra, artificial skin, which greatly reduces scarring and allows burn survivors to lead healthy, productive lives. Emily Woodrow and Zachary Jenkins are 2 brave children who have been given a second chance by this medical marvel.
Her battle for life began on May Day when fire swept through her nursery, disintegrated her crib, and attacked every inch of her body except for her bottom and the soles of her feet. 75% of her body was charred, her fingers burned right down to the bone.
Think back to 13 weeks ago today. You know, she was on her second day here, and not a lot of people gave her hope.
One of them was Rick Woodrow, Emily's grandfather.
Because I just had reached a point where I was afraid to hope. I will never forget the night of the fire, Dr. Fulcher's parting words as he got on the elevator were, "I'm really scared."
Can we try walking? Yeah, let's go get it.
3 months later, hope conquers fear. Just last week, Emily got out of intensive care. Now she's learning to walk again, forcing her joints and skin to stretch. She's learning motor skills. The cast on her hands help her to make a fist, something she can't do on her own yet.
Kids pretty much will deal with what they're given.
Emily got less than most, only a 25% chance of survival.
Anybody with burns as bad as Emily had, really, I think in most places around the world and in most places in the United States, probably wouldn't have survived.
Dr. David Heimbach says family support from Emily's mother and granddad was a lifeline.
Somehow I think she knew we were there. and she could still sense the love and feel the love. She's agreed.
Woodrow credits the staff at Harborview and modern medicine. Artificial skin called Integra covers all of Emily's burns. It attaches to tissue and closes burn wounds, keeping germs out. That's vital for burn patients who are often killed by infection.
You once characterized Emily as a miracle baby, and I think she really is. Her prognosis is great. She's going to be a normal kid.
She's already turned the corner. Now it's all about the home stretch.
I was in the kitchen making French fries to the deep fryer. He had learned how to run the day before, and he went around the counter. Before I got there, he had yanked just the plug in, and it hit the floor, splashed back up on him.
In an instant, the boiling oil burned then 11-month-old Zachary over 70% of his body.
So my husband tried to pull one of his socks off, and the skin just came right with it.
But today, 2 years later, Zachary's socks come off without a problem, and the skin on his legs and feet is smooth and pliable thanks to a newly developed artificial skin called Integra.
You can see that it's just a sheet of matrix, and that's the substitute for the inner layer of your skin.
The problem with patients with burns over at least 60% of their body is there is not enough healthy skin to graft over the scars. The Integra allows surgeons to remove the burn tissue immediately and use the artificial skin as a sort of dressing. Made mostly of cow and shark cartilage, it is so similar to human skin, it helps generate new cells. Within 6 days, blood vessels underneath begin to grow. Within 21 days, doctors remove the outer silicone layer and place a thin graft of the patient's healthy skin over the Integra. In just a month, what you see is smoother, more elastic skin than regular scar tissue. And doctors with Harborview's burn unit believe it is saving lives.
From that standpoint, we think that we are seeing improved survival because we're able to get rid of the burn wound earlier than we ordinarily would be able to do.
What a frog say.
That is certainly the case for Zachary. And what a difference for a little boy doctors weren't sure would ever walk again.
I love it. Anybody that goes through a burn should use it. I mean, that's the only reason why he still has all the toes he has is because of that stuff.
A medical breakthrough tested in Seattle, and the proof is in a little boy in Auburn.
Baby Emily and Zachary Jenkins, brave little ones who have used their childhood strength to overcome the horrible tragedy that came knocking at their door. Tonight we've heard incredible stories of survival from the lives of ordinary people, people just like you and me. Our community benefits greatly from a hospital like Harborview Medical Center, and with the community's support, Harborview will continue to be a guiding light for victims of disaster.